Welcome to the Naturally Healthy Pets podcast. Let's get to it. Hello and welcome. You're listening to Dr. Judy Morgan's Naturally Healthy Pets podcast, and I'm your host, Dr. Judy Morgan. My guest today is Dr. Matthew Muir from way across the pond from down under in Australia. He's an integrative veterinarian and has co-founded a whole food company called Lyka, which we can talk some more about. He's the clinical director of all natural vet care. He lectures around the world, and his main areas of focus are functional veterinary medicine, preventative medicine, herbal medicine, integrative oncology, and the gut-brain microbiota axis. And today we are going to discuss bacteria and brains, exploring the intriguing world of your pet's gut-brain microbiota axis. Matthew, thank you for agreeing to be my guest today.
My absolute pleasure. Thanks for having me.
So you're in clinical practice still, right?
Yeah. I spend half my time in clinical practice and half my time at Lyka. Yeah.
Okay, so pet food company, you've got an ebook, you're practicing, you're kind of like most people in the pet space. Like nobody says, oh, one job is enough.
Yeah, I also have an 11-month-old baby.
Oh, my Lord.
Well, we've got a
little sleep deprived.
I'd love if more people, like particularly in the vet profession, kind of jumped on board, and I guess they are to amplify the message. But I just feel like there's big changes that need to happen, and I'm just sort of thriving with the challenge of changing things that I don't think are right in how we look after our pets. So sort of had to go for it out of necessity, I think, for my conscience.
Exactly. If we get so passionate about what we're doing. So you're really passionate, obviously, about food and what is going into our pets' guts. Can you just give us a brief rundown on what the heck is the gut-brain axis and why does it matter?
Well, we can make it really complicated, or we can just sort of describe it more simplistically. Essentially, it's a network or a highway that communicates the head and the gut. So the gut-brain axis is a two-way street or highway, because there's a lot of information going on there between the brain and the gut. So it's how the gut, which is often called the second brain, talks to the head. And a lot of people would think from a computer or the control tower in an airport that the brain actually controls everything and tells the gut what to do. But increasingly, we're understanding that most of the information is coming from the gut and it's going to the brain, particularly the vagus nerve, which is a big part, one of the main communication pathways of this network. Think of it kind of like an internet. This network, the gut actually, 90% of the signals in this main nerve are coming from the gut to the brain. When we think about, and there's certainly clues of the gut-brain axis in everyday language, like I've got a gut feeling, got butterflies in my stomach, all of those sort of things that sort of give us clues that the brain's receiving a lot of information from the gut. And it makes sense when a lot of the exposure to the outside world for the brain, which is like nicely housed in our skull, a lot of the information it's getting, obviously it's getting it through the eyes and all of the senses, but it's also the biggest organ that talks to the outside world is the skin and the gut. So the gut's like the skin on the inside. So we're getting a lot of information to the brain. And then that information is really the master puppeteers behind that is the bacteria and other members of the microbiome, that the trillions of cells that live in our gut that are not our dogs or our cells. They're actually a symbiotic relationship with this whole ecosystem of little creatures that are helping to explain things and co-evolve with our brain.
Is that communication through chemical transmitters? How is that going up the vagus nerve?
And there's neurotransmitters involved, there's hormones, and there's immune cells, and also messengers called cytokines, which we'll maybe come back to because I think they're important when we talk about brain health. But we've got direct communication through the vagus nerve. We've got neurotransmitters like serotonin, dopamine. We've got the HPA axis, which a lot of people will be familiar with, things like adrenal fatigue, etc., and cortisol, stress, all of that sort of being moved between the gut and the brain through this network. And then with respect to why is it important, in my clinical opinion, or my opinion in general, I think it's important because it involves the gut microbiota first, and certainly from the naturopathic approach to medicine being that all disease starts in the gut, and also the modern science exposing how an imbalance of the microbiome or a dysbiosis is being linked and correlated at least with most diseases that we're seeing in our pets. Why I think it's mostly important, the twin pandemics that we're seeing in our pets, which is the anxiety, neuroinflammation, neurological behavioral disorders that we're seeing in our pets or challenges, and all of the gut challenges. All of the inflammatory bowel disease, the IBS or IBS-like syndromes, and then all of the ramifications of gut, which includes like skin. And then we've also got things like epilepsy, potentially even cancer from a dysbiosis, even heart disease, liver disease, kidney disease, autoimmune disease, all of the main diseases. Degenerative joint disease probably also has elements of problems with the gut microbiome. So we've got pretty much all of the diseases are now being looked at through the lens of saying, okay, how much is the gut and the gut-brain axis involved here? That's, to me, why it's really important to be thinking about this axis and knowing how we can try to manipulate it.
Absolutely. How does diet affect the microbiome? So if we had, let's take two litter mates, two large breed male canine litter mates, raised in the same home, same environment, same stressors, but one is fed a highly processed, high carbohydrate diet, and the other one is fed a gently cooked or a raw whole food diet. What would some of the differences in their microbiome look like?
Yeah, so it would have to be an educated guess because we don't fully understand how each individual is going to respond to a diet, but we do know they need different microbial layouts, so different sort of composition or population, and also bacteria performing certain duties within that microbiome, certain jobs to deal with and degrade the nutrients from those two different types of foods. But where the scientific evidence and certainly my experience in practice is sort of showing is that ultra-processed diets tend to lose diversity of the richness and evenness of species that are there. And what we tend to find is with the raw or gently cooked, we tend to get more bacteria that are associated with protein digestion. So because certainly if we've got a high refined carb, ultra-processed diet, one of the big differences, many differences, but one of the big differences is one's a low protein, high carb diet, so the ultra-processed diet. And then when we look at most whole food, generally speaking, most whole foods, the macronutrient profile is like high protein, low carb, moderate fiber. And what we find is also that the acrylamides and the advanced glycation end products from the kibbling process, whilst it's not really been shown in dogs, there's a lot of evidence in other species that impacts the microbiome layout. To me, normally what I find is they have more diversity. They also have more bacteria that can produce neurotransmitters like GABA, so sort of relaxing, sedatory type neurotransmitters when they're on raw feeding, whereas dogs and kibble have less of that. They sometimes have more bacteria. One of them's called Catenibacteria that has been correlated in some other studies, which find that now when we look at the layout of the microbiome, dogs that have phobia, anxiety, or even aggression, they actually have different patterns of position of their microbiome. And Catenibacterium, which is one of the ones that has been shown in kibble, is one of the bacteria that tends to be elevated in some of the dogs that have these layouts associated with different behavioral challenges. But it's very early days when it comes to looking at the science to predict what's going to happen. Some studies contradict one another, and really in the end it comes down to like, what is the microbiome producing? And certainly diversity seems to be consistently something that is mostly considered good, and we see that on the whole food diet. Within whole food, it also depends if they're on a whole food diet that has like phytonutrients, polyphenols, the right prebiotics, etc. To be fair to the ultra processed foods, some of it does contain better fiber profiles, and some of the diets really try to improve the microbiome, and certainly there's some science around that. But generally what I would find with those two dogs is the microbiome of the dog on the highly processed diet would start to become more obesogenic. The microbiome would actually shift, and that dog would likely to be more overweight or overweight relative to the naturally fed dog, is what my guess would be. My other guess, my expectation would be the dog on the kibble would probably end up getting metronidazole antibiotics for gut problems, and then they would lose their Peptoacidobacter hironsis, which is a keystone species that's really important in metabolism. And then their health, to me, would just diverge on two paths from about 3 years of age, unless we healed that microbiome. That's what I see in practice often.
Well, yeah, I saw it in practice too. And I think it's amazing. I think we need a lot more studies where we do exactly that sort of thing, where we can really compare apples to apples. But those studies take a long time to do. We need to take a quick break to hear from our sponsor. When we come back, we're going to talk some more about how we're treating these diarrheas and things too. Stay tuned. Thanks to Solutions Pet Products for sponsoring this podcast episode. Solutions is a raw fermented pet food producer that specializes in high organ percentage, complete diets, raw cultured goat milk, gelatin-based supplements, and herbal remedies. Using traditional farming and modern science, they work to provide simple solutions to complex problems. Modern agricultural practices have failed us. Pesticides, GMOs, over-vaccination, monocultural industrial farming, a flagrant abuse of soil and ecosystems. Solutions Pet Products works with small family farms to regenerate the land, and in so doing, revitalizes pets everywhere with clean, healing, ideally formulated, raw fermented pet food. Ask your local pet food retailer about purchasing options, or reach out to Solutions directly at nurture@solutionspetproducts.com. Defending your pet from glyphosate injury can seem impossible, thanks to how it's, well, everywhere. But you can support what's most responsible for your pet's natural defenses against toxins, their gut. Let me tell you about Ion Gut Support for Pets. It works by strengthening the gut lining and maintaining tight junction integrity at the cellular level. This means their gut is supported, so it can do what it needs to do to keep your pet healthy, and their gut does a lot. It's crucial for nutrient absorption, kidney function, a strong immune system, and the ability to defend against environmental toxins, including glyphosate. Simply by making Ion part of your pet's daily routine, you're doing all of that in a single wellness solution. Glyphosate exposure is inevitable, but the potential for harm doesn't have to be. Order now at intelligenceofnature.com and save 15% off your first order of Ion with the code Dr. Judy. Please note that naturally healthy pets may receive a commission on any orders placed with our code. Welcome back. You're listening to Dr. Judy Morgan's Naturally Healthy Pets podcast. I'm your host, Dr. Judy Morgan, and my guest today, Dr. Matthew Muir, is an integrative veterinarian from Australia and co-founder of a whole food company called Lyka Pet Food. You just brought up an interesting point that when I gave you my little case scenario, what do you think would happen with these dogs? And you said, well, the one on the ultra-processed food at some point is going to end up on some metronidazole for diarrhea. There was just a great study that came out in the American Veterinary Medical Association journal that I just read, where they actually polled a large number of practicing veterinarians and asked them how they treat acute diarrhea. And it scanned the gamut from benign neglect, doing nothing and just, seeing if it goes away, giving probiotics, putting them on a bland diet or a higher fiber diet, or supplying antimicrobials. And amazingly, the majority of veterinarians still run for metronidazole for acute diarrhea when we have great studies that have come out in the last year in that same journal that say that when they took dogs and just provided them with a probiotic and a little more fiber in the diet versus giving them metronidazole, the dogs that just had a diet change and a probiotic got better much more quickly than the ones on metronidazole. And 30 days out, their microbiome was in great shape versus the metronidazole dogs whose microbiome was still a train wreck. We have so much work to do to even get veterinarians and pet owners, because a lot of pet owners, I saw it when I was in practice. People will call, I need more of that metronidazole. My dog's got diarrhea again. Everybody wants a pill to fix something. And I don't think that metronidazole is doing us any favors.
No, I mean, the only time that I think it's doing us favors if it genuinely can't stop the diarrhea, and that's when I'd say, okay, maybe it's appropriate, although I'd probably reach for other antibiotics if that was the case. And also, if it's chronic diarrhea and people sort of ringing out, reaching for more, the relapse rate for metronidazole for chronic enteropathy, so this is gut problems that go on for more than 3 weeks, is something like 100% relapse rate in 6 months. Like, it will just happen again. So it becomes the definition of crazy to do it. And then with this, the bacteria that it wipes out, and there's some good articles on it, a lot of them, you can try to fix them and I think of it like an endangered animal, where you can try to, if they're critically endangered, you can try to sort of build up their populations in the wild, in the gut, by supporting them with prebiotics and the appropriate diet, which to me would be a whole food diet, to try and get particularly that Peptidocetobacter huronsis, which was previously termed Clostridium huronsis. I think they changed it because Clostridium's a bad word in medicine, but it's kind of extinct. That's when it's a problem. And we're giving metronidazole once, it might go endangered. Then the second metronidazole might go critically endangered. And then the third metronidazole, it's extinct from the microbiome of the dog, which will affect the dog's ability to metabolize bile acids, and the digestion and the risk of IBD probably goes up. And going back to your 2-dog thing, I want to raise the dog risk study that found that feeding ultra-processed diet in the first 6 months of life, which is something that's modifiable and that you can change, increases the odds ratio or the risk of getting inflammatory bowel disease over their whole lifetime. So what you do in puppyhood, so that's when I'm concerned about these young dogs ending up on metronidazole, is that to me, they set a course for progressing through to quite serious diseases. And often they need a fecal microbiome transplant if it's extinct. If the keystone species are extinct and you can't sort of build up numbers again using diet, herbs, prebiotics, probiotics, that's when you have to think about, okay, and stress management, definitely stress management, because we're talking about the gut-brain axis, then sometimes they need a fecal microbiome transplant.
Yeah. Do you find that you're in clinical practice, you have this dog comes in that's been on an ultra-processed diet, he's got dysbiosis, inflammatory bowel disease, anxiety, all these different things going on. How are you fixing? I mean, if you just change them to a fresh food diet, does that fix it? Or how far do you have to go with these to get them fixed, to get rid of all that anxiety and distress and stuff that's going on?
It depends how young they are, depends exactly how long their kind of medical history is. But I generally find they need more support than just the diet change. Normally, it depends where they're at. Like if they're on a hydrolyzed diet, like hydrolyzed kibble, prescription kibble, and they can't even add like a teaspoon of turkey mince without causing the dog to have diarrhea, then you're like, well, okay, this dog, we probably won't actually instigate a major diet change for a couple of months. We need to heal this gut lining. But it depends, because you should do multiple food trials before calling a dog true inflammatory bowel disease. They need immunosuppressive drugs or even antibiotics to deal with their gut problems. They should try multiple diets. So one of those diets should be like probably a low fiber natural diet. One should be a high fiber natural diet. But often what I do is I meet them where they're at. It's always different. But normally I do a lot of gut support, brain supportive strategies, which are generally the same herbs and nutraceuticals that I use very regularly, just to calm things down, get that gut lining healed, because from the sort of increased gut permeability or the kind of leaky gut syndrome, and now what we know as the leaky brain syndrome, which are those two things are connected. What I'm trying to do is seal that gut lining, calm things down, get their stress cortisol levels down, because the treatment, particularly if they've been hospitalized or had a lot of diagnostics, they're all very traumatized by the time that post-diagnosis. A lot of them are really traumatized. And even if the brain didn't play a role early on in the disease process, it probably is by the time I meet a lot of these pets. Some of my favorites are ashwagandha with Ania. I use it a lot because it's not only is it a prebiotic, but it certainly calms down the cortisone and cortisol in the body and is an adaptogenic, so they can adapt to their stress levels. I use a lot of lion's mane mushroom, which in dogs its evidence is actually as a prebiotic, but it also is known as a nootropic and helping with the brain through brain-derived nootropic factor, which is decreased in stress, depression, anxiety, gut problems. I use a lot of PEA. I think you're a fan of PEA as well.
I'm a huge fan of PEA.
PEA is my kind of gut, brain, skin, pain axis treatment of choice. I use a lot of colostrum because I find when you think about, you go do the timeline medicine and sort of read from diagnosis back to puppyhood, some of the dogs that have the worst gut problems, something went wrong around birth and they didn't get colostrum, or the mother was on antibiotics, or mother was only eating ultra-processed food during her lactation, which is shown to increase the lifetime risk of that puppy getting atopic skin disease, which is another big pandemic that we see. And certainly dog risk from Helsinki have found that most skin disease starts as a gut disease and then marches into this atopic march into skin disease. So I use a lot of those things. I use a lot of gut lining support like marshmallow root powder or Glycotrax, a lot of probiotics, including psychobiotics. So I use a lot of BL999 or PS128 probiotic strains for gut-brain axis support. Cannabis, medicinal cannabis I use. Generally start with PEA more than CBD oil. I do a lot of acupuncture for gut-brain axis things. And certainly I mentioned fecal microbiome transplant and obviously diet. But I don't generally start with a fecal microbiome transplant, even though now that I've done a lot more microbiome testing, I kind of know which patients would need to probably move to FMT faster than other patients that we can sort of restore the microbiome. Because as Dr. Margot Roman sort of says, it's really microbiome restoration therapy, not just FMT. And I find that over the years with our protocols, we don't need to get to FMT very often anymore. But I'm really excited about using FMT for more of the behavior neuropsychiatric disorders. And that's an area that really, for today's talk, to understand that fecal microbiome transplant in humans and some of the studies that have happened in rodents is showing that it has efficacy in treating or supporting a wide range of disorders and health challenges, including Parkinson's, spinal injury, Alzheimer's, autism spectrum issues, OCD, schizophrenia. Like they're using fecal microbiome transplant as a way to help support a lot of these disorders. So to me, the future of FMT in pets will be using it for behavioral challenges by manipulating their gut-brain axis.
Amazing. I had some really crazy behavior patients that, trying to get close enough to get acupuncture needles in was just not a lot of fun. I think sedation and a fecal transplant would be a lot easier.
And it has a potential to be a one-off therapy if you do the pre-work to get the gut and the right prebiotics that are going to support that fecal microbiome transplant. Yeah, we've turned around dogs that have very intense, high activity, severe IBD that are losing weight, that are like non-responsive to medications anymore. We've done fecal microbiome transplant in our practice for probably over 15 years. Obviously very like non-routine and experimentally 15 years ago in those patients that we'd sort of run out of options. But now, as we've learnt more, we now just start to go, okay, well, it's still not routine in that we're doing them every day, but we certainly know when they're appropriate and know how to discuss with the client when it's to give them all of the pros and cons.
Amazing. Man, we could talk about this all day, but we are out of time. Your website is Lyka, lyka.com.au, because he's in Australia. He also has a Facebook page, Lyka Pet Food. He's also on LinkedIn. We will put all the links in the show notes. And I believe Dr. Matt is going to have some goodies for everyone. We will put those in the show notes as well. Thank you very much for the work that you're doing. You clearly are well-versed on what's going on in guts. It's a big part of practice, but I think it needs to be because I think we've ignored it for way too long.
Absolutely. Yeah. Well, thanks for asking me on. Always happy to chat about this. Could chat for hours as well. But yeah, thanks so much for having me.
Thanks for listening to another great Naturally Healthy Pets episode. Be sure to check out the show notes for some helpful links. And if you enjoy the show, please be sure to follow and listen for free on your favorite podcast app. We value your feedback and would love to hear from you on how we're doing. Visit drjudymorgan.com for healthy product recommendations, comprehensive courses, upcoming events, and other fantastic resources. Until next time, keep giving your pet the vibrant life they deserve.
The purpose of this podcast is to educate and to inform. It is no substitute for professional care by a veterinarian, licensed nutritionist, or other qualified professional. You're encouraged to do your own research and should not rely on this information as professional medical advice, diagnosis, or treatment. Dr. Judy and her guests express their own views, experience, and conclusions. Dr. Judy Morgan's Naturally Healthy Pets neither endorses or opposes any particular view discussed here.